Hello, my name is Candace Kunkle, and I'm a project manager at the Graduate Medical Education Office at the Morsani College of Medicine at the University of South Florida. And this presentation is on developing a faculty development program for community and teaching physicians. As a recap, the United States is facing a physician shortage. There is an increased demand for curriculum reform, competition in the healthcare market, and an increased competition for clinical educators to support research. This shift in demand requires faculty members to acquire new skills in leadership, research, and clinical teaching practices. For my problem of practice, the USF, Morsani College of Medicine, and HCA West Florida had formed a consortium to increase a much needed graduate medical education in the Tampa Bay region, and in addition to help address the Florida's looming physician shortage. To help address the shortage crisis, several medical schools and for-profit organizations have formed academic partnerships to address the need to train and retain physicians within their local states. With the formation of new affiliations between the two systems by sharing academic resources, clinical faculty from both sides are expected to join forces. My job is to ensure the relationship between USF and HCA is cordial, and the academic resources that are delivered from these 6 domains adhere to the affiliation agreement. For the purpose of my study, I've decided to focus on faculty development opportunities. Healthcare reform initiatives and economic pressures have created advantages for hospitals and health systems to integrate, as this recent trend of formation of academic partnership has been identified in the literature. Academic medical centers are partnering with their community peers, forcing individuals to accelerate and adapt to this ongoing change. The role of clinical faculty has increasingly evolved into a discipline of its own. Even more is the development of these individuals within these various teaching and community hospitals. To understand the role of clinical faculty within its complexity must include the multiple missions and diverse settings that makes up these academic integrations. Clinical faculty, also referred as clinical educator, teaching physicians, attendings, clinical professor, is a clinician who is a teacher, researcher, and leader in academic medicine. Clinical faculty are expected to teach residents and fellows, produce research, contribute in administrative tasks while maintaining their clinical responsibilities. It truly is a balancing act for clinical faculty for both teaching physicians and community physicians, as illustrated in the literature. However, although they may be similar, there are differences between the two. When compared to academic medical centers, the educational component for community physicians is just not yet explicit. In general, health institutions and individual disciplines strive to skill medical teachers, researchers, and administrators for the evolving and current responsibilities. The competencies of faculty members are continuously being redefined. Several studies have highlighted the complex demands of clinical faculty with advancing medicine and technology. In support of these emerging clinical faculty roles and relationship, there is a need for adaptive management as well as adaptive evaluation to ensure shared goals, transparency, and collaborations among teaching and community hospitals. And it is possible, but it does require work. We created a faculty development program based on needs assessment conducted in the summer of 2019. As suggested by the literature, the need for a comprehensive faculty development to address clinical leadership tasks and organizational development to promote medical sustainability. We are continuing to develop our workshop through Microsoft Teams as webinars, while still offering CME credit for physicians as an incentive for their participation. Evaluating the quality of teaching and learning in order to sustain program improvement is my intent. As a theoretical framework approach, developmental evaluation is an evaluation approach that supports innovation development to guide adaptation to emergent and complex realities. As Michael Payton proposes, it supports the developmental process as the outcome. Developmental evaluation brings innovation and mutual adaptation into the process of asking evaluative questions, applying evaluation logic, gathering and reporting data to inform stakeholders in real time. This capacity supports innovation development within a unique and complex operation. To support the development of innovation in complex situations, it's different from other evaluation approaches. Summative evaluation measures outcomes against predetermined goals. Formative evaluations focuses on continuous improvement, whereas developmental evaluation is an evaluation for the developing and emerging initiative. Developmental evaluation, also referred as the adaptive evaluation, is different than a program improvement. It doesn't demonstrate that a program has been impactful at the closure of a program. Instead, it serves as an integral leadership function, which includes a results and learning oriented approach to testing program or organizational realities. For this ongoing curriculum development in response to the evolving roles, responsibilities, resources, and relationships, assessing the need is significant. Our series was put together from last year's needs assessment, and we are planning on putting together another one in this year as evaluation supports the learning. My goal is to evaluate the clinical educator learning series and to design it to be an adaptable and dynamically changing and real-world environment for our clinical faculty. As the literature illustrates, developmental evaluation is purpose and relationship driven, not method driven. As the gatekeeper for the series, I am planning to explore further the needs assessment that is driving the curriculum design and planning in this process, while also looking into the adaptive evaluation as a tool that may support in developing a more comprehensive professional program.